Medicare. That's America's promise to its workers that after a lifetime of work, you will have access to health care and not have to worry about illness or injury causing poverty in your old age. 66 million Americans are currently served by Medicare. Medicaid is an American promise of compassion, that those with disabilities will not have to beg on street corners for the health care they need, and that those who fall on tough times will have at least one option for stable, affordable health care when all of the other for-profit private insurance corporations would rather reject you or bleed you dry with jacked up premiums. Now, there are those who say that the 71 million Americans on Medicaid, well, that's too many. I say, why isn't every American deserving of stable, affordable health care? After all, they have figured it out in every other developed country, and in many of those countries, they now have longer lifespans. They have fewer moms and babies dying. They have better education outcomes. So to the MAGA folks who support the Trump big bloated boondoggle of a budget bill, and it's $930 billion, almost $1 trillion of upcoming cuts to Medicaid, because they say too many folks are claiming low enough incomes to qualify. I ask simply, why is that the case in America? In the richest nation on earth, why aren't we doing more to address why so many Americans have incomes low enough to qualify for Medicaid? Why are people who work full-time jobs for some of America's biggest corporations still making so little in pay that they qualify for Medicaid, that our taxes subsidize their health care? Why are the corporations and the billionaires behind them sticking us with the bill? About half of adult Medicaid enrollees, about half of SNAP beneficiaries work at least 35 hours a week. And more than half of them work for large companies, meaning 100 or more employees. So it's not that they're working for some tiny business that can't afford health insurance. These companies can, they choose not to. Look, we've had 60 years to make Medicaid stronger. Instead, it's about to get a lot weaker. We've had 15 years to make the Affordable Care Act stronger. Instead, it's about to get a lot weaker. We've had 20 years to make Medicare Part D stronger. And instead, prescription drug prices are about to get a lot higher. All told, we are about to see 12 million Americans lose access to affordable health insurance, either through cuts to Medicaid or the Affordable Care Act. And it's not like that happens in a vacuum. When they go without stable, affordable health care, when some of us go without that, the rest of us have to pay for that. So, happy birthday, Medicaid and Medicare. Hopefully we can make you live up to your promise sometime in the near future if you're not killed off in the meantime.